Will a weekend lift ruin my ability to have a deep plane facelift neck lift in 10 to 12 years? The truth is no. A weekend lift is actually a great setup for a facelift, and here's why. In the weekend lift, I'm actually doing the same things I do in the deep neck, the Crevasse technique. I'm actually taking away the causes of heaviness, parts of the gland, fat underneath the chin, moving the muscles back to the right position. So it's better set up for later on, and in fact, you might not need to address those issues when you come back for the secondary facelift. In the mid-face, I'm not doing anything, so there's not going to be any scar tissue or changes in the area that we're going to dissect across when we do our deep plane lift. Unless I do an incision that's hid behind the hairline and do a minimally invasive mid-face lift with an endoscope. But if you're in the deep plane, that's not a plane that creates scar tissue. So when I've gone back and done revision deep plane surgeries, I haven't seen a lot of issues because if the surgeon's in the right space, there's no scar tissue there. And if they're above that space in a more traditional SMAS style lift, still not a problem because I go below that level in the deep plane surgery. The bottom line is that a weekend lift is a maximally invasive procedure because it's a big surgery within the deep plane in the deep neck, but it doesn't affect in a bad way the ability to go back to those areas or to redrape tissues in the mid-face or other parts of the face later on. I think it's a good option and a good opportunity to have an early intervention to have a great neck, and it won't affect your ability to have a beautiful deep plane result later on in life.